Welcome to our channel. Do you know what the prostate is? The prostate is a small, walnut-sized gland located above the bladder in men. Unfortunately, prostate enlargement, also known as benign prostatic hyperplasia, BPH, is a common issue, especially in men over the age of 50. This condition puts a strain on the urinary tubes and bladder, causing problems with urination and increasing the risk of infection. In this video, we will explore the top 7 vitamins that can help shrink an enlarged prostate back to its regular size. These include zinc, phytosterols, lycopene, EGCG, vitamin C, vitamin D and lauric acid. These natural nutrients help stop the hormones that make the prostate grow. This helps the prostate heal and shrink back to its normal size. Top 7 vitamins to shrink an enlarged prostate. Look at some of the best vitamins, minerals, and acids for prostate health and protection. 1. Zinc. Zinc is a crucial mineral for maintaining prostate health. Low zinc levels are associated with an increased risk of developing benign prostatic hyperplasia, BPH. Additionally, zinc can help alleviate existing BPH symptoms. Foods rich in zinc, such as nuts and seeds, contain phytosterol, a compound that helps reduce urinary symptoms of an enlarged prostate. Pumpkin seeds are an excellent snack for individuals with BPH. They are high in zinc and essential fatty acids, which can reduce prostate inflammation. Research shows that pumpkin seed oil is well tolerated and effective in alleviating BPH symptoms. Its diuretic properties can help restore normal urine flow and relieve bladder discomfort. The recommended daily allowance for zinc is 9.5 mg for adult men. In addition to pumpkin seeds, other foods rich in zinc include eggs, wheat germ, beef, and cashew nuts. 2. Lycopene. Lycopene, a powerful antioxidant found in tomatoes and other red fruits, is beneficial for prostate health. Research suggests that lycopene can help shrink the prostate and alleviate symptoms of benign prostatic hyperplasia, BPH. This compound works by reducing inflammation and preventing the progression of prostate enlargement. Regular consumption of lycopene-rich foods has been associated with improved prostate health. Tomatoes, particularly when cooked, are an excellent source of lycopene. Other good sources include watermelon, pink grapefruit, red peppers, and papaya. 3. Phytosterols. Phytosterols are plant-based compounds that have been shown to support prostate health, potentially helping to shrink an enlarged prostate and restore it to a more normal size. These compounds work by reducing inflammation and improving urinary function, making them beneficial for individuals with benign prostatic hyperplasia, BPH. Phytosterols are found in a variety of plant foods, including nuts and seeds, almonds, sunflower seeds, and pumpkin seeds, vegetables, Brussels sprouts, broccoli, and cauliflower fruits, apples, avocados, and oranges, legumes, beans, peas, and lentils, whole grains, wheat germ, rice bran, and oats. Pumpkin seeds, in particular, are an excellent source of phytosterols and are often recommended for prostate health. They not only contain phytosterols but also essential fatty acids and zinc, which further support prostate function. 4. Epigallocatechin gallate, EGCG. Epigallocatechin gallate, EGCG, is a powerful antioxidant found in green tea that has been shown to offer significant benefits for prostate health. Research indicates that EGCG can help reduce prostate size and alleviate symptoms of benign prostatic hyperplasia, BPH. It works by inhibiting cell proliferation and inducing apoptosis, programmed cell death, in abnormal prostate cells, as well as reducing inflammation and oxidative stress. The benefits of EGCG for prostate health include anti-inflammatory properties. EGCG helps reduce inflammation in the prostate, which can alleviate symptoms of BPH and improve urinary function. Antioxidant effects. By neutralizing free radicals, EGCG protects prostate cells from oxidative damage, which can contribute to prostate enlargement and dysfunction. Inhibition of abnormal cell growth. EGCG has been shown to inhibit the growth of abnormal prostate cells, potentially reducing the risk of prostate cancer and BPH progression. Hormonal balance. EGCG can help regulate hormones associated with prostate growth, such as testosterone and dihydrotestosterone, DHT, further supporting prostate health. To incorporate EGCG into your diet, consider drinking green tea regularly. Green tea is the best natural source of EGCG, and consuming it daily can provide a steady supply of this beneficial compound. 5. Lauric acid. Lauric acid, a medium-chain fatty acid found predominantly in coconut oil and palm kernel oil, has been shown to have several health benefits, including those related to prostate health. Research suggests that lauric acid may help manage prostate enlargement and support overall prostate function. The benefits of lauric acid for prostate health include anti-inflammatory properties. Lauric acid can reduce inflammation, which may help alleviate symptoms associated with benign prostatic hyperplasia, BPH. Antimicrobial effects. Lauric acid has antimicrobial properties that can help protect the prostate from infections, which can exacerbate BPH symptoms. Hormonal balance. Lauric acid may help modulate the balance of hormones like testosterone and dihydrotestosterone, DHT, which are implicated in prostate enlargement. 6. Vitamin C. Vitamin C, also known as ascorbic acid, is a vital nutrient that plays a significant role in overall health, including prostate health. While it is well known for its immune-boosting properties, vitamin C also offers specific benefits for the prostate, particularly in managing and preventing benign prostatic hyperplasia, BPH. The benefits of vitamin C for prostate health include antioxidant properties. Vitamin C is a powerful antioxidant that helps neutralize free radicals, which can cause oxidative damage to prostate cells. This protection can reduce the risk of inflammation and cellular damage associated with BPH. Collagen synthesis. Vitamin C is essential for collagen production, which is crucial for maintaining the structural integrity of tissues, including the prostate gland. Immune support. By boosting the immune system, vitamin C helps protect the prostate from infections and other conditions that can exacerbate BPH symptoms. 7. Vitamin D. Vitamin D, often referred to as the sunshine vitamin, plays a crucial role in maintaining overall health, including prostate health. Research suggests that adequate levels of vitamin D may help reduce the risk of prostate enlargement and support the management of benign prostatic hyperplasia, BPH. The benefits of vitamin D for prostate health include regulation of cell growth. Vitamin D helps regulate the growth and differentiation of prostate cells, potentially reducing the risk of abnormal cell proliferation that leads to prostate enlargement. How to shrink enlarged prostate. Managing benign prostatic hyperplasia, BPH, through lifestyle changes can be highly effective. Here are some practical tips to help manage BPH. Maintain a moderate body weight. Healthy diet. Focus on a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Regular physical activity. Aim for at least 30 minutes of moderate exercise most days of the week. Exercise regularly. Cardio activities. Engage in aerobic exercises such as walking, jogging, cycling, or swimming. Strength training. Include strength training exercises to build muscle and support overall health. Avoid or limit products that cause dehydration, cold medications and decongestants. These can exacerbate BPH symptoms by affecting urinary flow. Caffeine and alcohol. Limit these as they can also lead to dehydration and irritate the bladder. Limit saturated fat intake. Reduce red meat and fried foods. Opt for leaner protein sources like poultry, fish, and plant-based proteins. Eat plenty of natural plants. Phytosterol-rich foods include green leafy vegetables, rice bran, wheat germ, peanuts, corn oils, nuts, and soybeans in your diet. Avoid harmful dietary supplements and environmental exposures. Pesticides and herbicides. Opt for organic produce when possible to avoid exposure to harmful chemicals. RBGH-rich dairy products. Choose dairy products labeled as RBGH-free or opt for plant-based alternatives. Consult with a healthcare provider before taking any supplements or medications. Additional tips: stay hydrated. Drink plenty of water throughout the day to maintain urinary health. Manage stress. Practice stress-reducing techniques such as yoga, meditation, or deep breathing exercises. Regular checkups. Have regular medical checkups to monitor prostate health and discuss any symptoms with your healthcare provider. By adopting these lifestyle changes, you can effectively manage BPH symptoms and improve overall prostate health. Thanks for watching this video today. Wishing you great health, wealth and happiness. Don't forget to subscribe for more health tips.